One thing I want you all to think about, and think very carefully on this. As soon as someone has proven to you that they can think at least a second or third grade level, and they are made aware of the behaviors that you say show a mental illness, and they've been aware of them, and they can explain them, and they want to live with them. You cannot fairly, rightly, or rationally force medicate them or covertly or secretly medicate them. Okay, an argument can be made that even if they weren't aware, or if they didn't agree that these behaviors were bad or threatening to other people or alarming, that it is always wrong to secretly or force medicate them. But there's no way around the incontrovertible fact that it is wrong and unfair and irrational, illogical, and nonsensical to force medicate or secretly medicate someone who is well aware of their behaviors and the consequences, or the potential consequences. That is evil, wrong, and shouldn't be tolerated in a civilized society, or even in an uncivilized one. Now, I make this video from the point of view of someone who has been researching psychiatry and the effects of psych meds for 20 years, with an emphasis on the sociological effect of psychiatry. I have over 3,000 videos of my behavior on and off psych meds and covertly drugged. I have 9 witnesses whose perspectives and the events that they've witnessed definitively prove that they're covertly drugging me, fuming me, and running some sort of a psychological operation on me. I have more witnesses that I'm going to place in, whose videos I'm going to put in a playlist that's is for witness testimony that doesn't definitively show that there's something going on, but their testimony seems to suggest that there is. With that being said, you must understand, when it comes to big pharma and the policies of mental health and legislation, there are special interest groups, private clubs, people with ulterior motives, bureaucrats, special advisors, and other relatively small groups of people who determine what should be done behind the scenes and what is the justification for not telling society. Now, I would like to draw your attention to the phrase informed consent. I would argue, and I know this is true, that a very small percent of mental patients actually are well informed about the risks and the benefits, but more importantly, why things work the way they do. When it comes to psychiatric medications, psychotropic pills, what have you, the decision to take these pills is a life-changing decision that has potentially deadly consequences, and certainly it affects the health, no matter how you slice it. This is not a decision to be taken lightly. It's not like, what do I want to drink today at McDonald's, Sprite or Coke? This is a very serious decision. And once you take that decision out of the hands of the patient, there are some serious ethical questions that are brought up naturally. You've pretty much created a moral dilemma in society and by the governing class, within the governing class. The problem is that these people notoriously do not have morals. They are immoral, indignant, and ignoble. They make decisions based on their greed and their complexes, and they don't agree on a great many things. So things are often left up to a secret vote within private clubs and special interest groups, such as the Business Roundtable and the Trilateral Commission, or the Council on Foreign Relations. Most of the decisions are made by non-elected officials or people who are not elected to government. And even if they were, it doesn't change the fact that what they're doing is wrong. It is of the utmost importance that every mental patient is made aware that psychiatrists are disproportionately non-religious people. And the main psychiatrists have the philosophy of science. Some are Luciferians, some are Satanists, some are into the occult. This is on record. And the most influential mental health figures, if you will, did seances and dabbled in the occult. Carl Jung, Sigmund Freud. So regardless how seriously one takes the occult, you must realize that part of their motives, part of their motivations are derived from the occult. Some of their motivations, rather. Now, over the years, I've noticed things such as an increased difficulty with articulation. And this is one of the effects of psych meds that they downplayed. They'll mention side effects, but they'll mention them in a way that makes it seem like they're rare. People need to know that side effects, short-term and long-term, occur more often than not. The vast majority of people on psych meds experience side effects, and every single person who has ever taken psych meds suffers long-term effects to their cognition, permanent cognitive damage. It is a grave injustice and a great disservice to downplay that irrefutable fact. They use excuses such as their lack of research into these things. They spend billions and billions of dollars on marketing every year, but they won't research the long-term effects because it's a no-brainer. For the same reason they know that cocaine use and alcoholism have long-term effects. It's the same reason they know that psych meds have long-term effects. But they simply do not take the time to do the studies because it's a long, expensive study and it will give them results that they do not want the public to be made aware of, which would have serious consequences on their marketing department, for their marketing strategies. The phrase, "to whom it may concern," comes to mind. Well, it should concern every single person in America, whether they're a mental patient or not. Unless they're some kind of an elitist who gives their family a pass, they almost certainly have mental patients in their family, or someone on psych meds who sees a shrink, or a counselor, or a therapist, or a psychologist. It is quite ridiculous to think that America shouldn't be concerned. I think we're all aware that people are kept busy and dumbed down. And, if they're not at work, they're watching TV or, maybe playing basketball or tennis or, whatever. They're not really looking into educational matters. And colleges don't really teach these things. What colleges teach about psychiatry is basically, straight from the marketing department of big pharmaceuticals. Big pharmaceutical companies. Straight from it. That's all they teach. It is an utter disgrace. So with all that being said, for the same reason methamphetamines helps people work harder and longer and more effectively in many cases, in many jobs, depending on the tasks and activities that are part of the job. There are psych meds that help people function and increase their standard of living. But if somebody was sad and they weren't doing a good job at work, would we, tell them to take meth? And if they didn't want to take it, would we hold them down and, inject it in their butt cheek? Would we covertly slip meth into their drinks and food? Well, I assure you right now that's being done with drugs like Adderall. People are being required by mental health kangaroo courts to take the drugs that they do not want and that they do not feel helps them. So even if there was one person in 100 who was completely batshit crazy and completely unable and incapable of making their own decision, it would still be wrong to pass legislation that makes 99 people suffer and forces them to take drugs that they don't want to take, just so that one person who is incapable of making their own decision has to take it. Think about it. It makes no sense. 99 people have to suffer so that that one person is forced to take his, drugs, which may or may not help him. It's insanity. I would argue that even that one person, no matter how crazy they are, has the right to determine for themselves whether or not they should be forced medicated. But one thing is for sure, that I think that we all should be forced to take a very basic test that a third grader, the average third grader, could pass. If we're going to be forced medicated, we should be required to take these tests. If you can pass a test that a third grader could pass, then you should have the right to make your own decision about whether you're going to be medicated or not. I mean, even third graders can make these decisions. They do basic math and they look at the consequences. That's why they're punished, right? Why do we punish third graders? Because we say, hey, you know better. That's why you're getting spanked. You're not a baby anymore. You know better. You're capable of making a decision and determining for yourself. I mean, we all know that if we don't do what the government and Big Pharma wants to do, they're going to set the stage to bring us back to the psych ward. In California, you'll be 5150, and it'll turn into a 5250, and so on. We all know that. Even the most batshit crazy mental patient I've ever met knew that, And I've been to psych wards and I've seen tons of people, and I've never seen anyone who I would say is so crazy that they don't understand that if they run afoul of the law or mental health, that they'll be taken to the psych ward. If they do it a certain way. They all understand that. It is insane what we do to people, how we treat people. That word treat, right? Mental health treatment. I mean, forced medication is bad enough. As traumatic as it is to be held down and strapped to a bed, 4-point restraints and flipped over and have a needle injected into your ass, it is worse to covertly drug someone. People doctors will say, hey, you know what? If you're on a high dose of medication, don't drive. Well, if you're covertly drugged, you might go to McDonald's or something. You get behind the wheel, right? You're drugged and you get in an accident. Whose fault is it? They're going to say it's your fault because you should have taken your medicine willingly. You see how insane and how sick and how much of control freaks these people are? These people are sickos. And the facts make it clear that our society is being manipulated by people in secret clubs, private clubs, privileged groups, privileged clubs, special interest groups, mental health advocates, kind of like the devil's advocate. Society's being manipulated by these people. And people are being covertly drugged and force drugged to this day. Right now they are. There's people who are being electroshocked right now. People who have court-ordered electroshock treatment right now. Now, I'm not an optimist. I'm not naive. I'm not gullible. I'm actually a pessimistic cynic. I don't believe that society really has the ability, the society other than the oppressors have the ability to outmaneuver the oppressors or to make a dramatic change. But I do believe we can resist them to a certain degree. Therefore, the more people who are made aware, the more likely we are to resist these people. And the more society will be forced to say, most of us think that psychiatry is wrong and forced medication is wrong, and that these people have gone way too far with their marketing, their coercion, and their manipulation. They're a bunch of crafty scum. And it's come to a point where the 99% of people have to face the 1% of people who oppress them. And they're not all rich. Some of them are poor. Some of them are middle class. But they're all part of these groups for whatever reason. I think that it needs to come to that point where we all decide, you know what? This government does not represent us. And it's because of these special interest groups and these mental health advocates and these privileged people and these privileged clubs, we need to take them on. And we need to ship them all to Antarctica or something. Let them have their own country and kill each other, trying to exploit each other and try to put each other beneath each other. Putting each other beneath themselves, So when you consider everything, two questions are then asked. Is it wrong to force medicate people, even with low doses of psych meds? Absolutely. I was on relatively low doses of psych meds. Most of the time I was on psych meds. And I've suffered cognitive impairment that has made my life worse than any perceived mental illness could possibly make it. Try giving a speech, stumbling on your words. Try trying to talk to a woman. The other day when I was at dinner with my parents, I'm suffering cognitive impairment and I'm saying things that don't exactly make sense when you look at it when you take it literally. But when you read into what I'm saying, you understand what I'm saying. That makes you come off as stupid and uneducated when I'm very well educated. I know better, I just can't communicate it most of the time, or at least a significant amount of time, because of the cognitive impairment from psych meds. And to know that society plays stupid makes me very mad. To know that there's these sniveling dogs, these inferior minds who are playing God and they're eugenicists, they're doing this on record. Oh, it makes me want to beat them down. These liberal progressive types, the Margaret Sanger types. She was a nurse, medical establishment, liberal progressive, in a mental health advocate group, in a eugenicist advocate group, in the American Birth Control League. It's never changed. These little privileged groups, these little private clubs, special interest groups in their network. And it all goes back to morality. If they were moral citizens, they would not do this in the first place. It's because they're not Christian that they do this. It's because they're not real Christians who actually live by the morality in the Bible that they do this. And that's why it is so important that you see the philosophies that created this. Psychology was a branch of philosophy, as I bring up all the time. These are certain groups of people who share philosophies in common that allow them to covertly drug and force medicate people. Real Christians say, you know what, I'll have no part of this, I resign. It's not a question. I'd rather be homeless than do something so immoral and disgusting. It is these fake Christians. It is these atheists. It is these occultists, these agnostics, and these Buddhists who rather, who want to kill people and limit the population to save the planet, because they love nature so much. Instead of admitting that Christianity would limit the size of families, we look at white people, for example, Christian Europe. They have low fertility rates compared to non-Christian groups of people who the non-Christians target for depopulation, while they pretend that Christianity wouldn't limit the population, and that if people were actually Christians, they would limit their families on their own, and they would wait for marriage to have sex, which would limit the population more, and so on. They don't want to admit this because they're hypocrites, they're sickos, and they're the fucking problem. They're the problem, and they bring in a problematic solution that creates more problems down the line. It perpetuates problems that human beings don't need to have. If everyone lived a moral life as a Christian, life in itself is a struggle. People get diseases, there's hard work, you get in accidents. Life by itself has problems. But when a bunch of problematic scum with inferior minds that believe in inferior philosophies, justify what they're doing based on their miseducation and their perceived intellect, their misperceived intellect, and, their talent. They might be talented at engineering or something. Doesn't mean they should be in charge. They might be a talented science, kudos. Doesn't mean you should be in charge. Even little kids know that. Did Einstein get up and say, what, I am the greatest scientific mind, according to most people. I should be a world leader. No, because the skills aren't transferable in that way. Fucking morons. But nevertheless, we have a bunch of pseudoscientific eugenic garbage, eugenicist filth, okay? And they've said, because we are social biologists, we should be in charge of social control. Pseudoscientific theory of psychology, fucking investing in garbage. I tell you, I know better than all these people. Let's look at this another way. They do not suffer like I do. Okay, these are people who don't take psych meds themselves. No matter how much they study, they truly do not know what it's like. They don't know what it's like to be completely sane and have your brain damaged by scum who don't know what it's like, who don't know you're going through, who don't listen to you. They don't know. And they have no right. They deserve to die. Okay, so the best argument they could make is really nonsensical. Their argument goes like this. Well, some of these people have some kind of brain seizures or something. They have absences where they don't know what they were doing during that period of time. Okay? That they don't see, they have an inability to look inside themselves. Well, this is a no-brainer. Simply make videos, and look back. If these people can look back at the videos like I can and say, you know what, I remember doing that, I can explain to you why I'm behaving that way. You know, if you're being oppressed and you have witnesses and mental health is still covertly drugging you, because obviously they know they're the main people's doing it, you know? They're the main people gang stalking people and stuff, you know? So the argument that these people can't look inside themselves and see what they're doing is negated by video cameras, cell phone cameras, web cameras, recording devices. Now let's say you take them to the psych ward, right? So your argument is they're in the psych ward because they're having symptoms of mental illness. And say someone doesn't want to take the psych meds. It's a simple matter of record them. Record them in groups and ask them to explain themselves. If they say, I cannot remember doing that, or I don't know why I was behaving that way, you know, then maybe that means that you should fucking drug them. Don't lie about what they said. And record what they say, and don't use technology to chop up the recording and and so on. Because these people will use any dirty trick to have their way with political dissidents. If they can pass a test that the average third grader could pass, and when you disagree with their behavior and you say, well, maybe he doesn't know what he's doing, maybe he can't see it in himself, and they're watching a video of themselves and say, you know what, I was hungry, I was mad, I was coming off of marijuana, I'm an alcoholic and I was, irritable. If they can explain it, and they remember it, more than they can explain it, if they remember it and they understand it and they saw it that way, they say, yes, I do realize I behave that way. Yes, I do realize people are alarmed or threatened by that. But no, I don't want to take psych meds. At that point, you cannot force medicate them ethically, morally, and with your scruples intact. At that point, you must let them make their own decisions. And if they run afoul of the law, then they should be punished like everyone else, mental disorder or not. That is their choice. That is their God-given free will. And anyone who doesn't see it that way is a greedy, satanic dog by philosophy and definition, and they should be shot.